to everybody and good afternoon. I'm Dr. Val Romero-Leggett. I'm the Vice President for Diversity, Equity, and Inclusion here at the University of Mexico Health Sciences Center and the Family Practice Doc. And just want to welcome everyone to our Hispanic Heritage Month Excellence Award today. And really just wanted to share that just such a pleasure to welcome all of you as we're ending our celebration of Hispanic Heritage Month with our esteemed awardees today. So thank you all for joining, and thank you to our awardees for the amazing work that you do and that we're going to learn about you a little bit more today and celebrate you. These Excellence Awards really began as a way that our office was acknowledging like our, again, the various national celebrations, right? All of our different heritage months throughout the year. And again, just being able to highlight like the contributions of members across the many, many important months that are celebrated. And I think what I think we find a lot of times too is we're all working so hard and we're doing our great work and everything. And, we become, sometimes a little siloed as well. And we're just doing work. And I feel like we need to celebrate more the wonderful things that we're doing and with each other and share that with each other as well. So, our office is very proud to be helping sponsor these. And it's always amazing. I thank our committee members, Dr. Lindsay Smart and Dr. Amra Swan and Kendra Hill from our team, because they were the ones who coordinated, soliciting the nominations and choosing our awardees and bringing us all together today. So thank you to all of you. Really appreciate that. And just to remember that these Excellence Awards as well are to honor individuals or groups or teams or organizations, right, who have really in the arenas of clinical research, community educational, or DEI excellence in support of whatever communities that they work with. So again, I also want to thank our nominators because you were the ones who recognized these amazing awardees. And we had many nominations, and we have our 4 awardees today, but we thank you for all of those who are nominated. We thank and congratulate all of the nominees because that's an honor as well. And we appreciate, again, people taking time to share about these exceptional leaders. And we're going to, again, learn more today. So I don't know if many of you knew, but, every year, of course, we have our different heritage months, but, this month for the Hispanic Heritage Month, there's always an annual theme. And this year's theme is Pioneers of Change, Shaping the Future Together. So I think this is perfect, right? It really encompasses how our awardees are leading efforts to drive positive change in their work for Hispano and Latino communities. And I think, as part of the largest ethnic group in the United States, right, our Chicana, Hispano, Latino significantly contributed, right, to our nation's identity and played a vital role in shaping the American culture. And, culture in all aspects, right, business and art, education, law, just naming a few. And we want to celebrate that and recognize that widely. So again, we feel that our nominees, our awardees today, truly embody excellence in their calling and their activism in support of our Hispano-Latino communities at UNM Health Sciences Center and beyond. So next in the program, the awardees are going to have the opportunity to share who they are and their journeys, how they hope to continue serving the Hispano-Latino communities, and what this award means to them. And then after all of the awardees have had their time to speak, we will open the floor and allow for all of you here who joined us, if you'd like to make some additional congratulations and words of support. And I know that chat's usually blowing up too, and people are offering congratulations, which is great, but there will be that opportunity for people to please also say a few words. And then Dr. Smart and I will be tag teaming and taking turns here introducing our awardees. Okay. So we are going to start with my privilege to introduce and welcome to the spotlight our first awardee, Ana Iros, a Spanish language medical interpreter at Patient and Family Support Services at the UNM Comprehensive Cancer Center. and she was nominated by Dr. Veronica Plaza. And congratulations, Anna, first of all. So yay, and congratulations to you. Thank you so much. So Anna, I'm going to turn the floor over to you and have you share a little bit about your story and
Thank you very much, Valerie and everybody, Dr. Romero and everybody. This was very unexpected. You know, for me, I didn't have any idea, and it was a huge surprise. So I was told to share my story on how did I become a health, a health professional, a healthcare professional. Right now, I'm 59 years of age. Thank you, Veronica. 59 years of age, and my first experience ever, was when I started. I was 27 and was a community outreach worker and educator. I did that for 2 years in San Francisco. It was 1990. And the Department of Health of that city was looking for outreach workers that were bilingual. The Latino community, Chicano community, Hispanic community was increasing in the HIV/AIDS epidemic significantly. Through that experience, I learned to work closely with people and patients. I became, I comprehended by then the cultural challenges and the importance of language access for prevention, education, and medical services. HIV/AIDS entailed, education entailed a lot of criterion managing social prejudices due to the sexual and drug use related to its transmission and risks. It was a time when I realized how diseases affected different communities and their access to healthcare services, including language barriers. When I came to Albuquerque, I started working for First Choice Community Healthcare, primary healthcare clinics. And it was in August 1999. I worked as a coordinator of the breast and cervical cancer screening and detection program. And also First Choice gave me the opportunity to work as a Medicaid and market exchange program enroller. And that's because the BCC program only covered the cost of checking and diagnosing breast and cervical cancer, but not for treatment. So that was my first relationship with UNM, referring the patients to the UNM Cancer Center, the hospital, and advocate for them to obtain the appointments as soon as possible. And at that time, I'm talking about like 2000, there was no, the UNM medical system didn't have interpreting services. It didn't, and it was kind of frustrating. And it was a huge barrier, but a lot of pressure came from different organizations in 2001 for the UNM's responsibility to establish interpreting services, language interpreting services. And finally, it did. It did in 2001 by the end, and not only for Spanish, but also for Vietnamese and for Navajo. Then later, the language in the medical interpreting adopted many other languages. And that made me so happy. Let me tell you, it made me so happy, and that it was adopted, this service. By then, in 2004, the National Council of Interpreting Healthcare developed the National Code of Ethics for Interpreters in Healthcare, which defines the qualifications and role of medical interpreters. And that's when I went to Bridging the Gap. The first, I was looking who's training, who's complying with this. So I went there, I obtained my qualifications, and no one at this point, no one can deny the importance of the medical interpreting. And that was a great achievement that the UNM adopted this department, because it's our main institution in the state, our main health institution in the state. And I've always wanted to dedicate my medical interpretation skills to facilitate access to Hispanics. That's my skill, my capability. And this is why I continue working at UNM. It's been very rewarding for me to work at the UNM Comprehensive and Cancer, the UNM Comprehensive Cancer Center. And it brings me reflection, recognition, motivation that my work throughout my life has been worth it. And that's it. It's a contribution, a very important contribution within the healthcare system for social justice for non-English speakers. And that's it.
Oh, thank you so much for sharing your story. I mean, just really appreciate it. And, there you were, trying to get people to understand the importance, of what you're saying and what was needed so badly at that time. And really applaud you for staying with that, right? And really knowing and believing that in your heart and knowing it, right? Like you live it and the people that you see in your communities and making sure that that was something you were going to continue to advocate and be. So we are so appreciative that you did and so thankful to you. And again, just congratulations.
Yes, and I thank very much Jill Shulka and Yolanda Sanchez for the support here at the Cancer Center, for the support they give to the interpreters. And I also want to recognize my coworkers, Eusebio Medina and Ruth Lopez Gaitan, for their support, because we need each other.
Absolutely. And thank you for thanking people, right? I mean, because it is like, Kara, it does take a village and takes all of us working together. Thank you for that acknowledgement. And I know we said we would allow the time at the very end of everyone speaking, but I think, and I had a couple messages, and I know some people can't stay the whole time. So I am going to just open it now, or we will as we have each person, and then we can do it at the end as well. But if anyone would like to offer any other words now, I know there's a lot in the chat, a lot of wonderful congratulations there, but if anyone would like to say a few words, and I see, our amazing CEO, Director of Comprehensive Cancer, Dr. Yoli Sanchez on, and anyone would like to say a few words, I'm opening the floor.
Yes, I would just like to congratulate Anna and the team for their amazing work. I met with them recently at a breakfast, getting to know you breakfast, and they were telling me that, their services go beyond, navigating patients to care and being the interpreter and providing culturally sensitive access to care, but the patients now become their patients throughout their journey. And when they need to refill a prescription or they have a question, they are the frontline people who our patients interact with. So I am so grateful. I'm touched. And Anna, we are so happy and so honored to have you as part of our team.
Thank you.
Thank you, Dr. Sanchez.
Hi, I'm Jill Schulke. Sorry, my camera isn't working. I just want to say congratulations to Anna. I'm her direct supervisor here, and she is amazing and such a hard worker and so loving and caring. And just what Dr. Sanchez was saying, it goes beyond just interpreting. It goes to care of people and making sure that they are not marginalized, that they have the care that they need, and that they are enveloped by the center. So we're so proud of you, Anna, and thank you for your service.
Thank you.
Thank you as well, Jill, and appreciate those words. Thank you.
I just want also to say it's a lifelong service that Anna, that you have provide, and for those families that are walking through the cancer center now, but also for the women that you serve back when you were serving at First Choice. We know that you are the voice, you are the face, you are the bridge that help them to walk that journey not alone. And many times being able to speak in their primary language and have that conversations are also part of their healing. So well deserved.
Yes.
Thank you, Dr. Plaza, and for the nomination as well again. Thank you. All right, and as I said, we'll have plenty of time also at the end for people that want to speak as well. Dr. Smart.
Okay, is my audio okay? All right, I had to switch to phone. I was freezing on the computer. It is great to be here, and it is my privilege to introduce and welcome to the spotlight our second awardee. We have Lydia Regino, Program Operations Director and Health Extension Regional Officer, HERO, at the Office for Community Health at the UNM Department of Family and Community Medicine. Congratulations, Lydia. And with that, will turn that over to you to have you share it and also be able to celebrate you.
Thank you very much. And I am just like Anna. I also this was very unexpected. It is a privilege and an honor. I'm really humbled to receive this award. And I actually wrote my speech because I still cannot believe this. And so I'm kind of nervous. And so I have actually done a lot of work with community my entire career. All the work that I have done has basically been from the heart. Never in my wildest dreams did I ever imagine that I would get an award for doing my passion to help the Mexican immigrant community. As a child, when I came to the US, not knowing English, sorry, every time I go back to my childhood, it just becomes real as to why I'm doing this. Okay. So as a child, when I came to the US, not knowing English, not knowing where I was coming to or what I would be facing, I soon realized that there was a lot of hardships we have to endure as immigrants. As I grew up and began my professional journey, I made it a point to support others who were walking in the same path because I knew how difficult it could be. That is why I have engaged in policy change work, community advocacy, linking families to resources, because I know how crucial it is for families to thrive. I can also say that for me, this is a family thing. My sisters, my nieces, my nephews, my children, this is actually a family work. Because of the hard life we have had, we decided that at any time, if it was in our hands or in our power, we would be helpful to others, the Regino sisters or the Regino clan, as the nonprofit world called us. And so ultimately, we do this because it has been our passion to support our immigrant community. The shape of my work started over 20 years ago with Community Health Partnership, supporting the immigrant community. Through that work, it became clear that is where I wanted to go. I have worked with educational activities, schools, nonprofits, clinics, but it was at the One Hope Clinic that is where I began to mesh my passion for community with research. For the research, I was able to bring in all the components of the experience that I had had up to that point, including my lived experience. Together with my colleague and partner, Dr. Janet Page Reeves, we have become this dynamic duo with the community component really leading and driving the research with the community. With Dr. Arthur Kaufman, we developed the model at the One Hope Centro de Vida Health Center, working with the community and on policy change to advance access, medical and health rights. And then together with Dr. Janet Page Reeves, we linked it to the research. We worked on diabetes research and immediately using what we learned to implement change. not waiting the 15 years or whatever it normally takes to move research into practice. We used what the community told us, and we crafted our diabetes project to support the patients to learn more about the disease and make changes. Patients at this clinic paid out of pocket, so prevention was essential to support them. We expanded this work through 3 PCORI grants, the last one being a huge PCORI research project where we learned a lot, including how to work with our community and how to approach the work from their perspective. Again, taking into account whether or not they have insurance, not only in the care that they receive, but how they approach their health, their own health needs. We also have our NIH-funded Tertulias R01 study with women immigrants. That project has become our great passion because of the impact we are seeing in the lives of the participants. Tertulias has taught us how to work more closely with community, but we know that we have to put community first. In research, that means recognizing that their needs are not the same type of needs that have to wait until the end of the project to be analyzed and interpreted and published. The weekly sessions we have held over the past 5 years with women have been so eye-opening. We are holding an exhibition to share the power of the creativity and wisdom that our participants have shown to us. It shines light on who they are and where they started in our project, where they ended, and know the roadblocks they faced and the hoops they had to jump through to be in tune with their own power and learn about themselves. Through the years on my personal and professional journey, what I have learned is that every time you are successful, there are people supporting you from every direction and every angle. You are part of the team. You don't accomplish things alone. During my One Hope years at the small clinic run by CHWs and now being meshed with the UNM system, we used to say that we are like a table. Each one of us is a leg. The table can't stand if one leg is missing, and every leg is as important. A decade ago, when I moved into the UNM system at the Office for Community Health, I quickly understood that I am in a great place. Everyone supports me and support each other. Dr. Janet Page Reeves, who's my boss, has been a great mentor in my learning about research. And now, because of her mentorship, we are working hand in hand with a lens on community. I also want to thank Dr. Art Kaufman, the big OCH boss. He always says that I actually boss him around, and I think I actually do. But honestly, he is such a big supporter and is always very open to giving us OCHers room to lead in this work, but also being right there with us on the trenches. For instance, just this last week, we took on the endeavor of saving the One Hope Clinic that was actually closing for good. He and I led this fight along with others who supported this effort, and we were able to accomplish a miracle to keep the doors open to continue to offer healthcare services to the Spanish-speaking immigrant community. There is a quote from a Tertulias participant. It is because what I have been doing, it's actually what I've been doing throughout my career, and what Dr. Janet Page Reeves and I are doing with our research, and what Art, Dr. Kaufman, and I all at OCH are doing in our work with community. The Tertulias participant came up with the best quote, and we have adopted it. It really makes sense. It is how we all should lead. We should all go back for the rest. She said, if I engage in something, I will come back for you. And if you engage in something, please come back for me. We are consciously doing this in our work with Tertulias and through also what we do with OCH. We are going back for the rest. Thank you for this opportunity again, and I'm very honored and humbled. And thank you, Veronica, for nominating me.
It was truly inspiring words, and I think that we are incredibly lucky to have you in New Mexico and in our institution doing what you do. So I definitely want to open the door for folks to be able to share their congratulations. I think Janet's got her hand raised first, and then we'll open it up.
Yeah, I want to go first. So I can't say enough about my partner in everything, Lydia, and really it makes me cry. But we couldn't do the work that we're doing if she weren't leading it. So Thank you.
I know we have lots again of wonderful congratulations in the chat as well. And I see a yay mom. Okay, that's a
This
good one.
this is Alma Olivas, and I apologize, my camera is not working. So this is I want to say congratulations to both. I know Ana for many years, and I know Lydia for many years. And I want to thank them for all the hard work they've done throughout these years, working in the community, not giving up, and always trying to find that extra something that our community needs. You know, it's not only about interpretation, or it's not only about, like Lydia said, about medical. It's about everything that our community needs. Right now, Lydia and I are working with one of our clients, and she doesn't have any furniture. And so we looking for furniture for this client. So again, just like Ana and Lydia, you know, it's true. It's really true that they go beyond the scope of work that is described, because they see the need in the community, and so they go beyond. So thank you for everything that you do, and congratulations, y bien merecido.
I also want to highlight the work that Lydia does with the financial aid office for the within the university. She advocates that everyone is being treated with dignity and respect there, and she have work into decrease the financial barriers, make it possible for the immigrant community to be involved in UNM care. And so thank you for that, and also for the work that you have done in maintaining and advocating for the funds that we receive through the meal lobby for the community health workers through the Pathway program.
Thank you, Dr. Plaza. All right, and we'll have time at the end again for anybody who might want to say a few more words. We will go on to, I have the privilege now of welcoming our third awardee, Rosalind Cinton Diaz, a health education consultant at the UNM Center for Development and Disability. Congratulations, Rosalind, and nominated by Francis Rodriguez, who I know is with us here, and I also see Carolyn Biswell, Rosalind's director as well. But I'll turn the floor over to you, and again, congratulations, Rosalind.
Thank you so much, Dr. Romero. I want to first say thank you very much for the nomination and the award also. It is, like everyone said, very humbling and very surprised by it, but I also take it in because it's important that we all celebrate our big wins. And I will say my journey began from my family. I was so privileged to be able to have the opportunity to go to college and do my bachelor's and my master's degree in health education and public health. And it's because of my parents' support and my family's support that I was able to have this opportunity. I am from Puerto Rico. In 2020, I relocated to New Mexico and looked for other opportunities, and then the world stopped. I did not have a job, didn't know what was going to happen, but the opportunity to work at the Center for Development Disability appeared, and I was able to have an interview. I had to wait a little bit because everything was on stop, but when it came back around and I was able to join the center, I found myself in a wonderful team in the autism programs, people who advocate for people with disabilities every day. And it was like it was meant for me. I come from a family who has always been involved in disability awareness and disability advocacy back in Puerto Rico. They are the pillars of my journey to become an advocate too. And they're almost everyone is here. I see them. And when I started at the center, I quickly saw the need for the community to have more Spanish information, participation, or even just them being aware of the services and all the information that we had at the center. And the wonderful team just let me do my thing. They heard all my suggestions, and I just told them, let's just roll with it. Doesn't have to be perfect, doesn't have to be all at the same time. We just have to start including Spanish speakers, have translation, have the materials available, and people will come. And for the past 4 years, I've been able to implement in different programs, such as the Partners in Policy program that we are able to have now interpretation and are in charge of managing the program where we have future advocates and there's translation, we have the materials, and it's just an honor to be able to do this and just to help the community, not only by providing stuff in the language, but also including the culture and the different things that we do. And I took the reins of a program that was already started called Hilos por el Autismo, which means monthly, and it's all in Spanish. And we talk to the community and parents and family members of people who are on the autism spectrum. But not only we create a space for them to learn, but also to interact with each other, learn about it, talk amongst themselves, and just create the space that they needed in order for them to realize that they can be empowered. And that's the most important thing for me, to be able to empower the community, not only to get services, but also to advocate for themselves, to feel like they are there and they have a voice. Thank you.
If you've muted, Val. I'm not sure if you're talking.
Shoot, thank you so much. Darn it, I know I'm going to do that once or twice today. Rosen, thank you so much for sharing your story. And just again, thanking your family and speaking to, the importance of so much that you were talking about, right? And the dignity and respect. And then, as you spoke here at the end and talking about the importance of empowering, right? Empowering people in the community, and how important and how wonderful to hear that it is definitely a family thing that they're here in the amazing work that you're doing. And thank you so much for that. And I'm going to open the floor as well for others who would like to congratulate or offer some words.
Well, hi, I'm Carolyn Biswell, and I've had the privilege of working with Rosalind for the past, Rosalind, we call her Rosalind at work, so sorry, for the past 4 years. And I've been at the center for quite a bit longer than that. And I've really seen, we're in the training department, so we do a lot of training, as Rosalind was saying, on autism spectrum disorder for the community, for families, for individuals with autism. And I've really seen the programs that we've had going on for a long time just really bumped up. She has really helped us with our outreach to the Spanish speaking community and given us kind of the confidence to do that. We're kind of a perfectionist team. So, when we do something, we want to do it perfect, at the same time. And just like what she said, it was like, just jump into it, just start. It doesn't have to be perfect, but you've got to start somewhere. And that really helped a lot, because then we could start. We started with some of our programs with just providing interpretation at the training, and then we moved into, okay, let's get the materials and the PowerPoints that go with those translated into Spanish. So she really has, across all the projects that we do, like I said, it's quite a lot, really included the Spanish speaking community. And that's really what we're all about, is accessibility for all people with disabilities, as well as other cultures. So we really appreciate it. Our portal has Spanish resources on it now, where, that as we didn't, quite a few years ago. So we're really honored to work with her. So thank you, Rosalind.
Thank you, Carolyn, and for the work that all of you do. Any others at this point? And again, thanking Francis for the nomination.
Hey, before I move on to the fourth one, I'll just add some final thoughts too. As a child provider who often is looking for where to refer for what seems to be a growing amount of need for assessment for autism in particular, but all neurodevelopmental disabilities, the ability to know that there is somebody paying attention to a population who would therefore be unable to access, even have less access than what I think the whole entire population has, is just really, I'm really grateful for that contribution and the attention to meeting those needs. So thank you, Rosalind, for the work you're doing. Okay, so I have the honor of introducing our fourth awardee, and this will be for Samantha Garcia, counselor and social worker at the UPC Psychotherapy Clinic. And we'd like to congratulate you for the work that you're doing, and as a fellow behavioral health provider for providing another significant access need, and I'm just grateful for the work that you're doing. And so congratulations, and we'll turn it over to you to say a few words.
Thank you so much. Primero que nada, muchas gracias por la nominación. I'm very grateful. I'm very, very appreciative. Similarly to, I feel like a lot of the nominees, it was a little unexpected. I was like, oh, I was awarded? What? Like, all right. And it meant a lot to me in the moment. I didn't think much of it, but as I was like really going through it and reflecting with like what this really means to me and going back to when I started my journey, a lot was coming up, and I have tissue because I'm a therapist. So if I cry, I've got it here right next to me. But my journey as a mental health professional actually began through my advocacy work, through my civic engagement work and my anti-racism work when I was in college. And I started earlier on with a lot of community-based organizations like Enlace, the Engaging Latino Communities for Education. I know Lawrence is here. Back when it was in middle school actually, but high school, and then I really got into it when I was in college. And seeing a lot of my community, right, mi gente like struggling and like whether it was trauma, depression, and anxiety, and I knew right deep down that I was like, well, could it be that severe scarcity? Could it be the lack of resources? Could it be that poverty? Could it be that institutional racism, right? And so I started to see the symptoms, right, which show up as like disorders, right, mental health disorders. And so I had the tools, right, and now I was like, okay, so how do we treat it, right? Because my goal, my calling is to go deep down, right, to address the root cause of the issue, and that's always who I'm going to be. And in the meantime, right, how can we ameliorate, right? How can we provide relief, like right now, right? Because that's the thing that, if we want to do systemic change, we have to start with our people, with our families, right? I once read this thing that said, if you want world peace, go home and love your family. And so I understood that deep down of like, okay, ¿cómo sirvo a mi gente, verdad? ¿Qué servicios, qué recursos les puedo proveer? And so I was like, okay, it's through mental health, right? Like it's mental health and psychoeducation. And as you all know, right, in Mexico is 60%, according to the census, right, was 60% of people in the state are people of color, who many share a similar story, right, of where their source and dysfunction are coming from. And so, I had a lot of like the resources as into like, this is why to my core, I believe, right, like it's the same story, same body, same story. And so I was like, okay, well, I can do it through this avenue. And so I got my master's degree in clinical mental health here at the university. And after that, I went to, I did some work with the Institute for Policy Studies in DC. I was working with them on focusing on the criminalization of race and poverty, which was really great, right? I was like, okay, so this is what we need to do to provide more services, because New Mexico, right, third poorest state in the whole country, right? Talk about trauma. And so when I came back, I was like, all right, like, I put my sleeves up and I was like, let's do this work. And that's when I came to the outpatient psychotherapy clinic. I've been doing work here with in outpatient services. I also did work in psychiatric emergency services, which was very rewarding, and it's something that I'm going to carry with me forever. And I do plan on continuing to serve my community and mi gente by providing mental health services in Spanish. I'm also the only bilingual therapist here. I will continue to advocate for them and I will refer them to services. And as I transition out of UNM, because I do want to go back to school, this is something that I'm going to continue to do. I'm going to continue to send people and refer them to the walk-in clinic. We offer like walk-in clinic services here, and which is very profound to me because when I came back here, I was like, wow, isn't it great that anyone from the community can come into the walk-in clinic and be seen that day and get a service like mental health, right? See a therapist that day. You just have to get on a waiting list, right? But you will be seen, and if you're not seen that day, like the next day, someone will call you, and then we can set up an appointment, and you will be seen. And that to me was transformative, right? Because growing up, right, our community is like mental health, like no, ¿qué es eso, right? Like, and so the stigma, right? So it's like really going into you know, a world where behavioral health, right? We're talking and communicating like a lot of like trauma, right? A lot of the things that our communities have struggled with for generations was seen as like, no, you know, we do it in different ways, right? It's like, no, we do it that way and we can also do it this way, right? And so it's been a privilege to be nominated. This award means to me, it's a reminder of my calling. It's a celebration of my parents, of my family, of my friends, of my communities, and my ancestors. And it's also, it reminds me of the value and the importance of acknowledging the short-term and long-term harms of like many of the institutions that we're part of, right, that continue to harm our communities. And so the way that I'm going about it is like, how can I, you know, foster individual and collective consciousness? And I wholeheartedly believe that awareness of this does stand to inspire interaction as well as move us towards revolutionary healing by transforming structures that, you know, as we see, continue to oppress many of our communities. And so I will continue to do the local work and also tie in that civic engagement and continue to advocate. And so I just want to thank who nominated me. I want to thank everyone for being here. And it's really meaningful to know that, you know, all of you individually are doing the work for our people here. Y es un honor. Muchas gracias.
Yeah, trying to find my unmute there. Thank you, Samantha. That was so inspiring. And, you know, again, I still can't believe that the only bilingual therapist at the UPC, I mean, that's like hundreds of visits. I mean, in psychiatric emergency services, it's speaking to like just sort of institutional roles in continuing oppression, you know, like we need to be doing better there. And so I'm grateful for you to be there. I hope you don't decide to leave. And if you do decide to leave, that you come back after you've gotten the further education, which I very much support. But, you know, the ability to have a bilingual therapist is essential. You know, you're talking about emotion and language being so tied to your first language, and it's actually, I would say, impossible to do therapy through an interpreter services, but with the best thing that we have often for those of us who aren't lucky enough to be bilingual. So thank you for your work. I'll open it up for some congratulations.
I will gladly start with the congratulations and echo what you just mentioned, Dr. Smart, which is it is such a loss for us to lose Sam. She is both an incredible clinician, but she is such a strong and compassionate advocate for not just the patients she serves in our community, but she has been an incredible advocate for the hospital staff, for systemic change and for looking at these areas of where we can better support the people we're with, the community. It is a massive loss to lose her, but I've been blessed and I'm incredibly grateful to have worked with her over the last few years and to spend time in school. So congratulations, Sam. You absolutely deserve it.
Good afternoon, everyone. I'd like to congratulate all of the awardees. I have been so impressed with Anna and Lydia and Rosalind as they presented beautiful words of wisdom as they continue to contribute in our communities. And I've had the privilege and honor of knowing Samantha for many, many years. We're so grateful to her for her many contributions in our community statewide for many years. We're very grateful that she is supporting our community through UNM Health Sciences. And we're extremely proud of you, Samantha. And I wish you the very best. Felicidades.
This is Salma again. I apologize for my camera. And Samantha, oh my God, I met you through the community. Felicidades, mija. You know, and felicidades to Rosalind as well. I just want to let all of you know that because I am a community health worker, I'm going to be reaching out to every single one of you in case I need some resources for our community. But other than that, felicidades, congratulations to every single one of you, all the work that you do. Thank you for everything that you guys do.
And opening the floor to anybody and everybody here today for any of our awardees. Just very powerful hearing the stories. So please, we'll open the floor for a little bit longer for anybody to speak to any of our awardees.
Dr. Romero-Leggett, I just want to add my gratitude to you and Dr. Smart, Dr. Swan, and Kendra, and everybody at the Office for Diversity, Equity, and Inclusion at UNM Health Sciences for continuing to coordinate a variety of Heritage Month initiatives for the last several years. Throughout the years, we've recognized many incredible leaders and transformational leaders that continue to impact our communities positively. We look forward to future celebrations, and again, happy Hispanic Heritage Month to everyone.
Thank you so much, Dr. Roybal, and for the work that you do. As we heard, we have an Enlace pathway awardee here today, so I love that. And I know as well, I'm going to ask Kendra. Kendra wanted to just pass something along to everybody and remind us of a little something. So Kendra, do you want to?
Yes, thank you, everyone. This is so inspiring. And I just want to do a quick plug for nominations for our Disability Awareness Month for our Excellence Awards. They are due today. So I just put into the chat a link, and you're welcome to send it to your networks, supervisors, employees, anyone you could think of. There's our last call for nominations for Disability Awareness Month for our Excellence Awards. So thank you all so much.
Thank you, Kendra, and again for your work in bringing all of this, to us today and throughout the year. And yes, encouraging everybody to continue the nominations, because this is how we get to learn about each other and share the amazing work that happens every day here, right? And a lot of it we don't know. So I love these. Any last remarks before I give a few closing remarks here? I'm just trying to look and scan both of our. Oh yes, please, Maria.
Hi, everybody. I just want to say thank you to all of you, because as Latina, I am so proud of you. And I really would like to say everybody, all Latinos here in New Mexico, I really would like to let them know that you have your nominees this year, because I'm very, very proud of you. I know most of you closely. Actually, I work with Lydia, and I just want to say I just want to send you my admiration and my proud as a Latina to all, but we can do it. We can do it. Thank you and congratulations. That's it.
Thank you. So wonderful. I know, and part of this, I'm telling you, every time we do these awards, there are definitely some tears, and it's from the heart, right? And it's beautiful to share, and I just really appreciate everybody who joined us today. And I want to offer from all of us again our felicidades and congratulations to our amazing awardees, Ana Iros, Lydia Regino, Rosalind Cintron Diaz, and Samantha Garcia. You all do inspire us. I heard that word, I've seen it in the chat, and it's so true, because it's really been an honor, right, to learn about you and your journeys today, and your definitely from the heart service, right? That's what you provide, and to celebrate you as you show up each and every day to provide the vital work that you do, as you empower those around you. And again, speaking the language of our people, of your people, and just sharing and uniting us all. And oftentimes providing such needed service that we have, so much more need, and you may be the only beacons out there, right, for us. So we really thank you for that. Thank all of you for joining and being able to celebrate our UNM Health Sciences Office for Diversity, Equity, and Inclusion Excellence Awards for Hispanic Heritage Month. And, from the bottom of my heart and from our office, we really appreciate all of you. And thank you for being here so we can just celebrate together. And again, I'm just looking for more ways we can do this more often. And you know what I was thinking? Because as we listen to the stories and everything, I'm going to figure out, I want to talk to Kendra because she's so good at this, but as we do these excellence awards, as we jump forward and people are talking, I want to start or at the end, we'll figure out a way to do a word cloud that would kind of be like, okay, this is what came out from today, these wonderful, strong, empowering words. I want to do something like that. Anyway, I am just going on and on because I have these ideas, and I feel so uplifted today, and just want to thank you all again, and to say to have a wonderful, wonderful day. And again, thank you for everything that you do.